Hello, this is Jessie. In this presentation, I'm going to talk about medical, surgical, and radiological treatments for head and neck cancer. Medical treatments for head and neck cancer, such as chemotherapy, are administered via IV in the form of a drug. Specifically, chemotherapy as a medical treatment slows or halts the growth of cancer cells in the body. It is reserved for when the cancer cells have spread to other regions of the body. In studies found from journals on cancer, the benefits and effectiveness of chemotherapy were addressed. In 2011, Blanchard et al. Studied the benefits of concomitant chemotherapy administration on all tumor locations, and found that there was a significant benefit overall. A few years later, in 2016, Blanchard and other researchers reevaluated the overall survival in patients that were receiving chemotherapy. It was determined that concomitant chemotherapy improved overall survival in patients with non-metastatic head and neck squamous cell carcinoma, in comparison to induction chemotherapy. These findings were confirmed in other research articles that added that the overall effectiveness was dependent on staging type of cancer, patient's age, sex, and overall health. Surgical treatments for head and neck cancer are used to remove cancerous or potentially cancerous groups of cells and tissues to keep it from spreading to healthy cells and tissues in the body. Surgery for head and neck cancer involves the removal of functional structures, for example, tongue, throat, jaw, bone, etc., and may be the result of removing lymph nodes that haven't responded to other treatments. It may also be done in order to place supplemental accessories such as feeding tubes if cancer has changed the patient's ability to swallow. This treatment approach is more of a last resort type of treatment, as it reduces the quality of life for a lot of patients and can cause major changes to their daily function. In studies done by Ritchie et al. And Zabrodsky et al., the effectiveness of surgical treatment was addressed. In 2016, Ritchie et al. Conducted a study on individuals with head and neck cancer who have failed primary chemoradiation and attempting surgical salvage. He concluded that surgical salvage had poor results and did not help overall survival rates, especially in patients who had N3 disease, also known as enlarged lymph nodes that measure greater than 6 centimeters in diameter. These patients had a lower survival rate. In 2004, Zabrodsky et al. Evaluated immediate and long-term surgical outcomes for major head and neck cancer surgery treatment in elderly patients. They determined that surgery was beneficial and valuable in elderly patients as long as their complication rates were weighed. They suggested that any coexisting underlying diseases should be addressed and taken into account before continuing with surgical treatment. Radiological treatments for head and neck cancer involve the use of high-energy particles or waves such as X-rays and gamma rays to destroy or damage cancer cells. Due to the way radiology is administered using waves, the risk of damaging healthy cells is something that is taken into account when determining the dosage and localization of treatment. Applying this type of treatment is dependent on the size of the cancer cell, where they're located, and what healthy structures are surrounding it, such as the eyes, brain, and other glands. In 2006, Boris et al. Conducted randomized trials to compare conventional therapy with hypofractionated accelerated radiotherapy to determine the effects of radiology. They determined that altered fractionated radiotherapy improves survival in patients with head and neck squamous cell carcinoma. On Cancer.net, the American Society of Clinical Oncology claims that for some cancers, radiation therapy alone is an effective treatment. According to the Centers for Disease Control and Prevention in 2019, the overall 5-year relative survival percentage in the U.S. is about 60.8% across all races and sexes for head and neck cancer. In terms of treatment, Dahlke et al. Looked into the overall survivability of patients who received radiotherapy and chemotherapy together in 2017. It was shown to be beneficial in patients with head and neck cancer and increased their chances of having a metastasis-free survival. However, this type of treatment is time-sensitive and is more effective if it is done under 40 days of having the biopsy. It was found that there was a decrease in overall survivability when the wait time was longer, for say 6 to 24 months. Here are some side effects of chemotherapy, surgery, and radiation therapy on patients in head and neck cancer, such as nerve damage, inflammation, blood clots, damage to tissues, organs, sore and dry mouth. For new treatments, in 2017, Cottle et al. Suggested a new method for radiotherapy in head and neck cancer. He proposed that treatment and doses be tailored in relation to the biological makeup of the individual. As of right now, the administration of treatment is sort of a one-size-fits-all type of treatment. He states that tailoring a genetic makeup might make the treatment more effective in accommodating to how the individual body would react to therapy. Finally, this is my works cited page. Thank you for listening. Bye.